Here are some notes on primary nocturnal enuresis. This is defined as nighttime urinary incontinence in patients with age of 5 or greater, and it's specifically in people who have had no prior prolonged period of overnight dryness. So they were never actually potty trained, and they're still wetting the bed. On the other hand, if you have been potty trained and you've regressed to now starting to wet the bed to now having nighttime urinary incontinence at the age of 5 or greater, that's not considered primary nocturnal enuresis. The pathogenesis is mixed. It could be related to delayed maturation of bladder control. It could be increased nocturnal urine production, sometimes as a result of increased fluids in the evening or decreased ADH secretion. And it can be related to low bladder capacity. Risk factors include family history and boys aged 5 to 8 years old. So oftentimes it'll be a 6-year-old boy that comes in that keeps wetting the bed, can't get this problem fixed. His dad had the same issue until he was 7.5, and that's a classic story for primary nocturnal enuresis. The evaluation typically involves a urinalysis. This is usually to exclude other causes such as a UTI. Voiding diary is also helpful as well to make sure that they're actually wetting the bed, finding out when they're peeing before they go to bed to make sure they don't have too many fluids at night as well. Lastly, treatment and management. First, you want to treat comorbid conditions like constipation. These would be a cause of secondary nocturnal enuresis. That would be an easy way to rule out primary nocturnal enuresis and get this problem fixed. You can try behavioral modifications, as we mentioned previously. These evening fluids, you can restrict to those to prevent wetting the bed. You can have an enuresis alarm. This is oftentimes built into blankets or bedding where it detects fluid, it detects the child peeing, it automatically sets off an alarm and triggers the child to go use the restroom outside of the bed. And lastly, you can do Desmopressin therapy for a quick fix for like an upcoming trip or a sleepover party.